I'm Marina Tarasova, and welcome to My Happy Thyroid, your source for all things thyroid health and wellness. My Happy Thyroid is presented by Paloma Health, the first online medical practice focused on living well with hypothyroidism. You can go to palomahealth.com to learn more. On last week's episode, we talked about a major study of 12,000 hypothyroid patients that showed the dissatisfaction patients feel with the current treatment options. Today, we're going to jump into what we can do about that dissatisfaction. So on this episode, we'll discuss how to stand up for yourself as a hypothyroid patient, work with your provider, and we'll talk about a checklist of questions and topics that you could bring to your doctor to discuss. As we discussed last week, while doctors should be your partner in the wellness journey, the truth is that nobody really knows how you feel better than you do. Your lab results may check out as normal, which happens in many cases, but you may still not feel normal or your best. And this is where it's important to become your biggest advocate. And also find a provider that listens to your full experience and is committed to being a partner in helping you to feel better. As we know, the American Thyroid Association estimates that more than 20 million Americans suffer from thyroid conditions. Our research actually shows that it's closer to 27 million patients that actually experience hypothyroidism. So therefore, it's definitely one of the most common chronic conditions that we have in the United States. And we also know that women are affected by far 5 to 8 times or so more than men are. And not to say that men aren't affected, of course they are. But instead of this sort of large epidemic number leading to a cure, we don't have a cure, and we actually have more of a one-size-fits-all treatment in the way that many providers look at labs and in the way that many providers treat the symptoms. So, but I think our audience and we as Paloma Health really advocate a more tailored approach and personalized approach that a doctor and patient can take together to feel better. So let's talk about what you can do to make sure you're getting the right personalized treatment to make you feel your best with hypothyroidism. Let's start with step one. It's really important to educate yourself. To become an advocate as a patient, you really need to understand the condition. And there's a lot of resources out there for you to go deep on researching hypothyroidism. There's definitely medical textbooks. You can get them on Amazon. There's a lot of books that have been written by authors. Dadis Karazian is one. Isabella Wentz is another. Do your own research. Find the philosophy that makes sense to you. Paloma Health, our blog, has a lot of information that you can browse for free. And you can also, of course, have conversations with your doctor to get more educated. And hopefully your doctor has time for that. Additionally, you can find support and connect with others that also manage their hypothyroidism in support groups and online forums. So there's plenty of groups on Facebook. Instagram has a lot of folks that talk about their condition and educate others about the latest research out there. So after you've researched your diagnosis and your hypothyroidism, then you should do the same for the treatment options. And there's quite a few. The most common treatment option is levothyroxine. So that's the T4 hormone that your thyroid isn't producing enough of in many cases, leading to the underactive thyroid. Levothyroxine happens to be the most commonly prescribed drug by many measures in the United States, which is quite interesting. It's also one of the most prescribed drugs in the world. But obviously, it is not a one-size-fits-all treatment. We're all unique, and our bodies process hormones and drugs and have individual sensitivities that are unique. So the fact that that's the number one prescribed drug is quite interesting. It obviously won't work for everyone in the same way. So finding the right treatment and the right dose is a step-by-step process. It takes time. It takes close monitoring and a lot of times tweaking with the dose and even the treatment to get you to feeling your best. Levothyroxine, and Synthroid is the brand name. Synthroid comes in 12 doses. If I'm not correct, some generics come in 10 or 12 as well. I don't think all the generics have quite 12 doses, but at least 10. That's a big range, and it's dosed in micrograms, so it needs to be very precise. Your thyroid is extremely sensitive to hormonal changes. So one of the big things that you can do is research the doses and talk to your doctor about getting to the right dose that works for you and gets you feeling your best. It's also important to discuss all of the treatment options with your doctor, including the side effects, the costs, the efficacy of all possible treatment options. Thyroid replacement hormones, they do work. But like we said, it's important to get the right ones and to get the ones that are the exact dosage for what your body isn't producing to help your body actually make up for that lack of hormone. So that's a little bit about treatment options. And I think it's really important to do a very deep dive and educate yourself there to have that really robust discussion with your provider. Step 2, we recommend a partnership with your doctor. So, just like any relationship, developing your relationship with your doctor takes effort. If you have a friend or significant other where you disagree or you're unhappy with something they did, you don't just walk away. At least I hope, we hope not. The goal should be a partnership with your doctor. In many cases, the doctor is, we should think of that relationship as a long-term one. It's also a pretty intimate relationship, and that's another reason why it makes sense to put effort into it. It's not about proving your doctor wrong or doubting their knowledge and experience. It's also presenting kind of what research you've done and hearing their perspective as the expert. Of course, they're the expert, but they're also human after all. And a discussion about why you may or may not agree with something or why you have further questions about a treatment option that they're recommending can really go a long way. The other thing we recommend there is if after the visit you still don't feel well or you have additional questions, call your doctor. It's not always an easy thing to do. We feel, doctors are busy. You call the office. Sometimes you don't get the doctor. You leave a message. There's a lot of back and forth, but call them. Let them know you're not feeling well. Sometimes if a doctor doesn't know that, what your experience is on a treatment plan after you leave their office, they can't help you. They can't help you make a change and feel better. What we hear from our doctors is one of the most frustrating things for them is that they have a patient come back to them 3, 4, 5 months later and say, I've been so tired and after we changed my dose to XYZ and I just, I've been suffering. And that could have been alleviated with a phone call. And I know it takes a little work and maybe you need to call an office back and maybe send an email. Hopefully your doctor has an email address for you to easily reach them. But let them know if you're not doing your best between visits so that they can help. Hopefully that's a little tip that can help. Number 3 is understand your labs. I know that the hypothyroid community is really big on understanding their labs, but it's really important to have an evidence-based view of what your labs provide. So many hypothyroid patients draw their labs every 3 or 4 months, sometimes every 6 months or every year, depending on how you're doing. But you should be able to read and understand your lab results on your own, just to be as you're on your way to becoming your advocate. While many labs only look at the TSH, so that's the thyroid stimulating hormone, that's the hormone that's produced by your pituitary gland to tell your thyroid how much thyroid hormone to produce, we believe it's also critical to measure other aspects of your thyroid. So it's important to know how much free T3 and free T4 your body produces. So free T4 is the carrier hormone. That's the main hormone that your thyroid produces, and then your body converts it to free T3. Free T3 is the active hormone that actually goes into every cell in your body to help metabolize the energy for critical functions. And so it's important to know the levels of those two hormones in your body as they're the ones that do the work. It's also important to test your TPO antibodies, maybe not every time if you don't have Hashimoto's, but for patients with Hashimoto's and other autoimmune conditions, it's important to monitor your TPO antibodies. So in summary, it's important to know and be able to read your own labs so you can have that intelligent conversation with your provider. Moving on to step 4, consider other factors beyond your medication. Even though medication and taking it the right way every day is very important to feeling your best with underactive thyroid, it's also important to take a holistic approach and having an open mind to what has you feeling down or not your best. And it's important to know that to get to a solution with your doctor. While we believe it's smart for you to find a thyroid doctor who loves what they do and makes you feel heard and understood, we don't advise that you stop seeing your primary care physician either. We also think that nutrition is really important so that you can discuss in depth your diet. Some doctors are trained in nutrition, which is great, and some of our Paloma doctors are. But a lot of times endocrinologists and doctors don't have that real deep nutritional training where you discuss everything you ate and you calculate your calories and what they should be for you and the specific foods that may be triggers for you. So having a relationship with a nutritionist, if you're able to, can really help and go a long way to getting you a personalized nutrition plan. So we really recommend a well-rounded care team. Some people may need to see a physical therapist to get some of their joint pain in control. Some people need to see a gut health expert as well. There's, of course, a growing connection between the thyroid and gut health, which we'll cover in another episode. But you may look at caretakers that specialize in that. And all your providers should work together to help you feel your best. So feel free to put them in touch with each other. Each doctor should know and care about what tests have been ordered. It should be easy with your providers to share labs between them. If it's not, maybe ask them how you can make it easier, and tell each doctor what diagnoses you've had, other medical conditions besides hypothyroidism, of course, and always let them know what medications and supplements you take. Now let's talk about a quick thyroid checklist that before your appointment, you may want to jot down of questions and topics to talk about with your doctor. So we covered labs. Talk about the labs that your doctor has ordered for you and make sure if it's appropriate for you that it's not just a TSH test. It depends, of course, where you are in your treatment journey, where ordering just TSH, if you've been feeling great for many years, may be appropriate. But if you're not, make sure your doctor is ordering more than just TSH and some of the other markers we talked about, including the antibodies. Then also talk about the lab ranges that the lab that you're going to uses for the normal ranges and what evidence base exists on where you should be with those markers and how that may differ from patient to patient. Also talk about and write down things that are going on in your lifestyle that may impact your thyroid health or your overall health. Not everything that feels like it's your thyroid is your thyroid. So write down how many hours you've been sleeping for the last few months. Write down the exercise you've been doing and write down general dietary changes or dietary patterns that you have. Those are really important to address with your doctor. And finally, make sure you mention supplementation. So things like if you're taking vitamin D or not taking vitamin D, it could have a huge impact on thyroid hormone absorption. So you may need to either get that tested or increase or decrease your supplements if you're taking them. Also talk about vitamin Bs, ferritin, and iron. Again, either recent labs that you've done, supplements you take, or should you be taking them. That's really important to discuss with your doctor. Also, one last thing, make sure you ask your doctor the best way to take your thyroid hormone. Just a quick tip from us, and you may have a different situation, but many people think you have to take your thyroid hormone in the morning. You actually don't need to take it in the morning. It doesn't matter if you take it in the morning and night or at night. It's just important to be consistent with when you take it. And if you take it in the morning, you have to take it 30 minutes before any food or drink, and 4 hours before you take any other supplements. So something we recommend to our patients is taking their thyroid hormone either in the morning or night, and any other supplements and medication the other time. So if you take your thyroid hormone in the morning, take your supplements at night. So that's a quick checklist. We really recommend doing that and having all of those things covered in your sessions with your thyroid doctors. That's it for today. Quick and easy. Hopefully these tips help you as you think about your thyroid care and give you some tips to becoming a better advocate for your own care. My Happy Thyroid is presented by Paloma Health, the first online medical practice focused on living well with hypothyroidism. You can go to palomahealth.com to learn more.